Huntington's disease has long been one of the most feared and cruel genetic conditions in human history, a relentless and devastating disorder that strikes people in the prime of their lives, runs through families without mercy, kills brain cells with no regard for age or circumstance, and robs patients of their memory, mobility, independence, and dignity, combining the worst aspects of dementia, Parkinson's, and motor neuron disease into one unstoppable catastrophe. But now, for the first time, doctors have successfully slowed its deadly progress through a revolutionary gene therapy, a breakthrough that scientists themselves described with tears in their eyes as spectacular, with the potential to turn a disease that has always been considered a death sentence into something manageable, something that no longer defines or destroys entire bloodlines. And the numbers speak for themselves because data shows a 75% slowing in the clinical progression of Huntington's disease in patients who underwent this new treatment, meaning the decline you would normally expect in 1 year would now take 4 years, buying families time, giving patients the chance to live decades longer with good quality life, restoring hope to people who had lost it for generations. And this is not just medical progress. This is a human story of people like Jack May Davis, a 30-year-old barrister's clerk who has lived under the shadow of the Huntington's gene his whole life, knowing his father died from it in his 50s, knowing his grandmother suffered the same fate, and knowing for years that he too was destined for that decline. But now he can say with relief and gratitude that the future is brighter, that life is longer, that hope has returned. And this change is made possible by one of the most cutting-edge approaches in modern medicine, a combination of gene therapy and gene silencing technology, where surgeons spend 12 to 18 hours in delicate brain surgery guiding a microcatheter through 2 key brain regions under live MRI, infusing a safe, modified virus that carries specially designed DNA to the neurons, where the virus works like a microscopic postman, delivering genetic instructions that transform brain cells into miniature therapy factories, producing microRNA fragments that intercept and disable the toxic messenger RNA, which would otherwise build the deadly mutant Huntington protein, a protein that normally exists to support the brain, but in its mutated form kills neurons one by one until nothing remains. And with this intervention, the toxic process is permanently slowed, the brain cells are rescued, and the progression of the disease is held back in a way that researchers themselves never imagined possible, with the trial showing not only better motor function, cognition, and daily life management for patients, but also lower levels of neurofilaments in spinal fluid, meaning fewer brain cells are dying than expected, an unprecedented outcome that specialists at University College London describe as breathtaking, emotional, and beyond their wildest hopes. And while some patients experienced inflammation or headaches from the virus, these were manageable and resolved, leaving the overall safety profile strong enough to justify moving forward. And that matters because the potential here is not just extending life, but fundamentally transforming the entire field of neurodegenerative disease treatment, opening the gates for therapies that can eventually target stage 0 Huntington's, patients who carry the gene but do not yet have symptoms, raising the possibility that one day Huntington's could be delayed indefinitely or even stopped before it starts, a goal that until now has been unthinkable. And though the therapy will be expensive, requiring highly skilled neurosurgeons and intricate hospital infrastructure, its long-term benefits make it potentially cost-effective, especially when compared to the staggering human and financial toll of end-stage Huntington's care. And while there is no official price tag yet, the UK's National Health Service already funds a £2.6 million per patient gene therapy for haemophilia B, proving that these kinds of transformative treatments can be supported if the outcomes justify the cost. And in the United States, the company behind this therapy, Uniquare, plans to apply for regulatory approval in early 2026 with the goal of launching later that year, while conversations with European and UK authorities are planned to follow, setting the stage for a new era where a diagnosis of Huntington's is no longer synonymous with despair. And yes, the number of affected people may not be as high as some other conditions, about 75,000 currently living with Huntington's in the UK, US, and Europe combined, and hundreds of thousands more carrying the mutation who will eventually develop the disease. But for every single one of those families, this breakthrough represents something priceless, a future, time with loved ones, years of independence, milestones once believed impossible, children seeing their parents walk longer, partners not losing each other too soon, entire family lines spared from devastation. And this is why scientists and doctors were moved to tears when they saw the trial data, because this is not just numbers, not just clinical charts, but real lives rewritten, real destinies altered, and a long-awaited victory over a disease that has stalked families for generations. And although we must wait for peer review and more trials before calling this a cure, the reality is clear. Huntington's disease has been slowed, meaning its iron grip has been broken for the first time in history, and from here, the only direction is forward, toward prevention, toward earlier treatment, toward a world where Huntington's does not end lives in their 30s and 40s, but instead becomes something people can live with, manage, and outlast. And to everyone carrying that gene, to everyone watching loved ones decline, this is the moment they have been waiting for. A moment that proves science can fight back against the cruelest conditions, that hope is not naive but real, that the battle against Huntington's is no longer hopeless. And although there are challenges ahead, cost, accessibility, surgical complexity, and regulatory hurdles, the door is open. The future is changed. And for once, a disease that seemed unstoppable has been forced to slow down, a 75% slowing, an unimaginable gain of time. And with time comes everything: love, family, achievement, dignity, life itself. Because what this therapy gives is not just medicine, it gives back futures that were stolen. And no matter what obstacles remain, that is nothing short of revolutionary.